Why should we have some drugs being overstocked at MSO that we don't use regularly as the country? Well, the drugs that we use regularly, we don't have them. You see? The reason is simple. One, MSO just receives the drugs.
Procurement of fake drugs, overstocking and drugs expiring in the hands of the medical stores are worrying scenarios. Where is the problem? Pharmaceutical Society of Zambia President Jeremy Kanyika says lack of qualified people managing the procurement and distribution of drugs is the reason.
Drugs, I don't know even who receives them. But we just have a situation where drugs have found themselves at the health center. And the people who are dispensing them, you don't even know who are these dispensing the drugs.
Cases of drugs such as adrenaline and gentamicin procured by the Zambian government being withdrawn are also of great concern.
Was the record gentamicin replaced with a new batch of gentamicin, or Zambia has lost the money like that? That's what we should ask. Because once we call a product is recalled, it means that that product will not be used. Like where we saw about 53,000 worth of adrenaline was also recalled. But was a new batch of adrenaline supplied back to the country, or the country has just lost the money like that?
The Zambia Medicines Regulatory Authority, Zamra, through its Senior Inspector Beatrice Kabaso, however, says investigations are underway in a case involving gentamicin.
This is still undergoing investigations. It's not yet closed. So the moment we close the investigations, we will tell the public what was happening.
The duo spoke when they featured on Joy FM Radio's The Platform program.
45% of that budget goes to the pharmaceutical, that is medicine and medical supplies. See, that's where 45% of the entire Ministry of Health budget, 11.2% of the nation budget goes to pharmaceuticals and medical supplies. But when you go on to Ministry of Health, you find that there is one not directed for pharmaceutical services. Then you wonder to say, who handles this 45% of the money? You should want, every Zambian should get worried to say 45% of the money has no one to point at. We need to get worried.
So the procurement process is done at Ministry of Health. We don't do procurement. We just issue import permits to those that want to bring medicines into the country.
Mwapeko Mwenda, Prime TV News, Lusaka.